Hi, this is Dr. Woeller for SIBO Mastery course. The title of this presentation is called Using Integrative Medicine for Small Intestine Bacterial Overgrowth. This is an overview of the SIBO Mastery course. So small intestine bacterial overgrowth is actually a condition where large numbers of normal bacteria are found in the small intestine. And these bacteria are primarily coming from the large intestine. Now, small intestinal bacterial overgrowth, also called SIBO, is often a cause of irritable bowel syndrome. And because of the compartmentalization of the digestive system, particularly between the small intestine and the large intestine, it's now known that they both contain unique type of normal bacteria. So if we look at this slide here, we can break the digestive system down into various components. We've got the stomach, we've got the small intestine, and the large intestine. Now the small intestine is quite unique. It's very long, and there's different regions within the small intestine that play a role in a number of different digestive system functions. So for example, the duodenum, which is closest to the stomach, is actually an area that's also close to the pancreas, and is an output where pancreatic enzymes occur. The jejunum is the middle part of the small intestine. This is actually an expanded region of nutrient absorption. And the ileum, which is the furthest down segment of the small intestine close to the large intestine, is a major area of immunity, often an area that's compromised in inflammatory bowel disease in the small intestine. It's also the last section before entering the large intestine through the valve called the ileocecal valve. So how does SIBO occur? Well, in some people, there's a dysfunction in the ileocecal valve, that valve between the small intestine and the large intestine, and that allows for normal large intestine bacteria to backflush into the small bowel. Now that can occur because of anatomical defects that might occur in that area. Somebody who has abdominal surgery, for example, that could alter that valve. Also, various organisms. So viruses, parasitic infections sometimes can alter the function of that valve. And when this occurs, there again is an overgrowth of normal bacteria in the small intestine, and the toxins that get produced, or the gases that get produced, are coming about because these bacteria are now fermenting different compounds, or they're fermenting the food that we eat and producing these types of gases. The migrating motor complex is also affected, and I'll talk about that here shortly. The damaging effect that can occur along the surface of the digestive system, including the small intestine, can be significant. We have to remember the small intestine has an area for immune function as well as digestion and absorption. And these finger-like projections called the villi have these little hair-like structures called microvilli that can become damaged because of toxins being generated within the small intestine. Now that could damage the immune system, could also damage the way the digestive system is absorbing nutrients. Gas damage within the small intestine oftentimes will, as I mentioned before, cause harm along the surface lining of the gut. And sometimes the symptoms that come about by different gases can give a certain clinical picture. So for example, hydrogen gas is often related to a higher propensity for diarrhea. Methane gas in the small intestine will many times manifest as constipation. Now, in some people, they have both going on. They've got high hydrogen as well as high methane, and so the bowel pattern is a bit mixed. It can be loose stools, diarrhea, associated with periodic constipation. So the symptom causation of SIBO comes about because of the gases, as well as the damaging effect that the gases can have in the small intestine, and then the different types of toxins that also can be generated as well. So bloating, pain, altered bowel movements, flatulence. Sometimes the systemic effects that can occur because of these gases can be quite significant. If we look at this list, I mean, the list is quite extensive, okay? The symptoms of SIBO. Now, one thing to remember, the digestive system can only respond in so many ways to certain problems that are occurring. So we may have a similar symptom picture that could be correlated to a fungal overgrowth or another type of bacteria or a parasitic infection. So testing becomes quite important. But one thing to remember about SIBO is the issues aren't occurring just in the digestive system. That's sort of the problem area, but the effects of what's happening in the gut can be felt systemically. So you can have individuals who have fatigue, body and joint pains, headaches, skin disorders. It can lead to brain fog and lead to sleeping problems, etc. And there are many different types of diseases and disorders that have been linked to small intestine bacterial overgrowth. I mean, this is actually a short list of what you're seeing coming up on your screen. The list of things can be quite extensive, and these are all references, this is all research, this is all known within the scientific community. Even autoimmune conditions can be linked to SIBO. As I mentioned before, chronic fatigue, liver disorders, gastrointestinal reflux. So testing becomes important to make sure that the symptom picture we think is SIBO is actually SIBO. Now, there's a number of different factors that can lead, again, to small intestinal bacterial overgrowth. Digestive system problems occurring in the stomach. Lack of hydrochloric acid, for example, can contribute. People who are on proton pump inhibitors to reduce stomach acid can be a cause. The diminishment of pancreatic enzymes can also trigger SIBO. The disruption of what's called the brush border, the lining of the small intestine. Now that can occur from food intolerances, that can occur from other pathogens like parasites or other bacteria. As I mentioned before, improper ileocecal valve formation, biofilm formation that's occurring in the gut, and then a defect in the migrating motor complex. So the stomach is our first area of digestion. I mean, really, when we chew and produce saliva in our mouth is really the first place that digestion begins. But if we think about the gut, I mean, the stomach plays a big role. One of the things that can actually contribute to SIBO is Helicobacter pylori. Helicobacter pylori is a bacteria that infects the lining of the stomach. It can alter hydrochloric acid production and set the tone for dysfunction throughout the digestive system. So testing for H. pylori is very important. Many people have their small intestinal bacterial overgrowth issue triggered because of some kind of infection. In addition to, or I should say, separate from Helicobacter pylori. These could be viruses, this could be parasite infections, this could be other bacterial infections. And what happens is there's a toxin called CDT, cytolethal descending toxin. This triggers an immune response within the body that then attacks the skeletal proteins within the digestive system, and it inhibits or it destroys something called ICC. ICC stands for interstitial cells of Cajal. These mediate the enteric or the digestive system nervous system activity. This is what creates that pacemaker effect of something called the migrating motor complexes. And the migrating motor complex is this electrical unit that creates these small electrical waves that move through the intestinal system, and the primary function is to help to move bacteria and debris through the small intestine and get it to move into the large intestine. So it's not accumulating essentially in the small bowel. Now, all of us will typically have anywhere between 9 to 11 migrating motor complex waves that occur over a 24-hour period of time. Most of them are occurring during fasting states, so during the middle of the night. they've shown that in people with SIBO, the level or activity of these migrating motor complex waves are greatly diminished, sometimes around 3 daily. One of the other problems when we start to accumulate bacteria in the small intestine that's coming from the large bowel is some of these bacteria are what are called gram-negative bacteria. Gram-negative bacteria have as their outer membrane something called lipopolysaccharide. And lipopolysaccharide is an inflammatory chemical that can lead to things like insulin resistance. It can lead to microglia activation in the brain and nervous system. And this lipopolysaccharide can damage the inner lining of the digestive system. In fact, what it's doing is it will disrupt the tight junctions. And the tight junctions are these structural units that help maintain structural integrity within the bowel. And this is important certainly within the small intestine. Now what's very interesting is if you look at the architecture of the tight junctions in the digestive system, they're very similar to the tight junctions that make up the blood-brain barrier. And so what this means is that individuals sometimes who have SIBO or other types of conditions that are affecting the digestive system can not only have leaky gut, is they can end up with a leaky blood-brain barrier. This is how some of these toxins are able to cross over into the brain and nervous system. So there's a lot of different causes for small intestinal bacterial overgrowth. There's also a lot of treatments that can be implemented as well. It's important to understand that with SIBO, it's not just about decreasing the bacterial load in the small bowel. We have to work on digestion, motility. We have to work on the health of the large intestine as well. And part of the digestive system is also the liver and gallbladder. That plays a big role too. And so it's really a comprehensive approach to bring more normal function back to the gut as opposed to just using things to decrease bacterial load in the small intestine. Biohealth Laboratory, which is one of the labs that we discuss in depth, has a number of different small intestine bacterial overgrowth tests, breath tests. They use lactulose, there's glucose solutions, there's different, there's the SIBO 900 profile, there's the SIBO 901 profile, all of which we discuss in depth in the SIBO Mastery course. This is an image of a normal SIBO profile. As we can see here, we have normal levels of hydrogen and methane gas, despite the fact that we're getting a rise in hydrogen and methane towards the end of the cycle. That's a normal phenomenon as the lactulose solution is moving into the large intestine. High methane, as I mentioned before, can often be associated with constipation. And so this is a test that's positive for high methane. Some tests come back just high hydrogen. Others have a mixed pattern where we have high hydrogen and high methane. In this particular profile, you would expect this individual to have problems with loose stools as well as constipation, a lot of bloating and gas, a lot of discomfort. There's other testing that's important. We can't just focus on SIBO testing because SIBO doesn't occur just on its own. It has to manifest over time. There has to be some type of trigger. So part of the SIBO Mastery courses, we go through extensively other test considerations, looking at H. pylori, looking at parasites, stool testing for C. difficile toxins. We look at digestive system function. We're looking at glyphosate. Glyphosate is an herbicide that can disrupt the microbiome of the gut, and it can actually contribute to an overgrowth of opportunistic bacteria. Many people don't think that Candida could be a link to SIBO, but it is. There's some people with SIBO who actually have a fungal overgrowth in the digestive system, including mold. And so we'll actually go through mold profiles to identify mycotoxins as a potential link to SIBO. These tests come from Great Plains Laboratory. Lipopolysaccharide, as I mentioned before. Food sensitivity is significant. And then we'll spend a significant amount of time on organic acids testing as it relates to digestive problems. This test specifically comes from Great Plains Laboratory as well. So the organic acid test adds another level of assessment that we believe every practitioner needs to know how to use because of the amount of information that this test can provide. This is just page 1 of the organic acid test. We can see here markers 2 and 4 indicate a mold overgrowth in the digestive system. Number 7 and number 6 are specific to invasive candida. Markers 16 and 17 that you see here on the slide are linked to Clostridia bacteria, and these are toxins in addition to the toxin A and B that's commonly picked up on stool testing for Clostridia bacteria. These also cause damage in the gut and can also cause problems within the brain and nervous system, which is another discussion that we have within the SIBO Mastery course. There's a bonus module lecture within the SIBO Mastery course called How to Interpret a Great Plains Laboratory Organic Acids Test. This lecture lays the foundation to how to quickly assess an organic acids test from Great Plains, critical piece of this course because we start going section by section, getting into things more in depth. There's a number of treatment options that are to be considered for SIBO. Dietary intervention is absolutely critical. So we'll go through dietary intervention in depth in this course. As I mentioned before, we have to support digestion. It's not just about reducing bacterial load. We have to support digestion, we have to improve motility, and we have to work on elimination. We have to work on large intestine health, liver and gallbladder support as well. That's all part of the process. Of course, we need to use botanicals, sometimes and/or antibiotics to reduce the bacterial load, but the story doesn't end there, because we now need to work at restoring normal gut mucosa health, the damage that has taken long term because of inflammation and gas damage within the gut. And then prevent relapse. One thing about SIBO is it has a very high recurrence rate. That's why in some people it's extremely difficult to treat. And this is where conventional medicine falls short, is all they do is focus on step 2. They just give an antibiotic or sometimes botanicals to lower the small intestine bacterial load, but they don't work on the other segments and other compartments, which are absolutely essential. So I'm Dr. Kurt Woeller. I'm the co-founder of Integrative Medicine Academy. I am one of the presenters within the SIBO Mastery course. I have been an integrative and functional medicine practitioner for over 20 years. I do lab advising for BioHealth Laboratory. I do a tremendous amount of education for Great Plains Laboratory. I specialize in digestive system problems, autoimmune disorders, adrenal issues, as well as autism spectrum conditions or autism spectrum disorders. And I've spoke throughout the United States as well as around the world. I do a tremendous amount of clinician education as well as parent and caregiver education for those with autism. Joining me in this course is Dr. Tracy Trincatella. She's also a co-founder of Integrative Medicine Academy. She has extensive knowledge in naturopathic and functional medicine now for over 20 years. She too does lab advising for BioHealth Laboratory and works a lot with women with regards to women's hormones and health, a lot with regards to SIBO and other gastrointestinal problems, etc. So who is this course for? Well, the course material is designed specifically for health practitioners, whether you're an MD, a DO, a naturopath, a clinical nutritionist, a chiropractor, and you're just needing more in-depth information about SIBO and related digestive problems. This course will have tremendous amount of information for you. But this course is open to other people as well. So you don't have to be a health practitioner in order to gain this information. If you're an individual who's just interested in learning more about SIBO for yourself or perhaps a loved one, this will be a tremendous benefit for you. But again, the material is designed for health practitioners, so it will be very in-depth and intense. Module 1, there's 9 modules within this course. Module 1 is about clinical issues and what are called comorbid conditions linked to SIBO. We'll also add information into this module about Helicobacter pylori, testing pathogenicity and treatment, because we know that is a trigger for many cases of SIBO. Module 2, we'll get into lab reviews. We'll go through lactulose testing, glucose testing, interpreting tests, reading between the lines and tests that are kind of inconclusive, and then always correlating the lab test to the person's symptoms. Module 3 will go through the 5 core elements of SIBO and successful treatment: migrating motor complex dysfunction, cytolethal descending toxin problems, autoimmunity, the role of digestion, the role of mucosal immunity in SIBO, the role of the large intestine, liver, gallbladder, and bile acids in SIBO intervention. This will be a very extensive module. Module 4 is now incorporating antimicrobial treatments, whether it's botanical, antibiotics. We'll get into different ways of doing that. Also dealing with constipation and die-off reactions too, which will come up for certain people who are very, very sensitive to the overload of these bacteria. Module 5 is about diet. Okay, so we'll go through different types of diets, including the low FODMAP, as well as the SIBO-specific diet, but we'll incorporate other things too. So things about specific carbohydrate diet, food IgG elimination, etc. Module 6 is now bringing in other aspects of things that cause problems. Invasive candida, mold overgrowth, basically fungal toxicity. Here we'll spend a tremendous amount of time on the organic acids test from Great Plains, why the organic acid test sometimes is superior to stool testing, and the different types of treatment options for fungal overgrowth. Module 7 is talking about Clostridia bacteria, and this is more than just C. difficile produced toxins within the gut. We're getting into other toxins that Clostridia can produce and how these toxins can not only affect the nervous system in the digestive system, but how it affects the broader nervous system as well as the brain, and how that can correlate to neurochemical problems in individuals who are dealing with these chronic infections. Module 8 is looking at parasitic infections, as well as antibiotic and botanical interventions for parasites and other pathogens. And we'll be comparing the GI pathogen screen from BioHealth, as well as looking at comprehensive digestive stool testing too. And then Module 9 is about incorporating digestive system detoxification protocols. This is an intervention to do for people with SIBO or sometimes other digestive disorders. It helps to clear the symptom picture. Sometimes people have so much debris, so much toxin built up in their bowel that in order to get them feeling well, in order to sort of move them forward, is to put them on a bowel detoxification program to sort of clear the symptom picture. This is a lecture that Dr. Trancatella will be going through different ways of doing it, step-by-step guide to bowel detoxification, looking at different botanical and supplement programs that are useful for this. Within the SIBO Mastery course is an extensive library of documents. We have what are called brandable documents. Basically on the right-hand side of the screen here is a brandable document. This is a Word document that you can alter. You can add content to it. You can take content away. You can add your practice name to it, whatever you want to do, and use it as an internal handout in your practice. We also have PDF documents, and this is really meant to be more for your own internal use. You could use those for handouts as well. We've got protocols, we've got supplement sheets and other articles. All of this comes with the course, in addition to the color format of the slides. So we actually give you large expanded PDF documents that are all of the slides in color format, as well as what are called note-taking versions, where there's 3 slides listed on each page. So you can print out those before the lecture and take notes as you follow through. Each of our courses, including the SIBO Mastery course, has pre-scheduled Q&A sessions. These are done live. This is where you come on, an opportunity to ask questions, and a lot of times during those Q&As we'll do lab reviews, we'll go over case studies, etc. And then there's a forum. So everybody who takes the course, you don't have to wait for the scheduled Q&A session. You can ask questions on an ongoing basis, on a daily basis if you choose, through the attendee forum. So why take this course? Well, in addition to the unbelievable amount of in-depth material you're going to get, it's about cutting down on time, right? Cutting out the years of training, the countless hours studying, the thousands of dollars that it can cost to travel to conferences and seminars to obtain this kind of information. We're compressing this information to you in a very short period of time, things that have taken years to develop in clinical practice. You can also get immediate help to your questions through the participant forum or the attendee forum of the course, right from your computer, whether you're in your office or at home. And again, there's a ton of information and support material, office documents, protocol handouts, etc. We also provide access for people who need it to lab testing. There's a company called Lab Tests Plus that provides access to biohealth as well as Great Plains Laboratory. So organic acid testing, SIBO testing, mold testing, other tests that we'll talk about in this course can all be accessed from Lab Test Plus. And when you do a test through Lab Test Plus, the results actually come to us and we provide what's called a written review of the important markers along with action step suggestions about what those markers mean. So the SIBO Mastery course is an extensive 9-module course with all the information I just talked about and much more. There are early bird discounts available. There's continuing education credits available as well. The course comes with exams. There's a certificate of completion that you can get after the course is done, after you've successfully gone through and taken the exams. And then we always provide extended access to course material after the live version of the course is completed. So there's still time after the course ends if you haven't had a chance to keep up or you need more additional time. That's totally fine. So for more information about the SIBO Mastery course, go to sibomasterycourse.com. If you have any questions, you can email us at sibomasterycourse@gmail.com. Again, this is Dr. Kurt Woeller for the SIBO Mastery course. Again, if you have questions, please reach out to us, and we look forward to participating with you in the SIBO Mastery course. Thanks so much.